Welcome to the WRAL Daily Download. I'm Jack Hagel. Big news out of the North Carolina legislature. Republican leaders reached a deal to expand Medicaid to hundreds of thousands of the state's working poor. It's the culmination of a decade of legal wrangling over the subject. WRAL state government reporter Travis Fain is here to break it down for us. Travis, welcome back.
Yeah, thanks for having me.
Okay, first off, give us the lay of the land. Lawmakers call a surprise press conference and say what?
And say that the biggest issue on the table for North Carolina politics over the last decade plus is decided. Like, oh, yeah, we fixed that. We solved that. We're going to expand Medicaid. We're going to change a few hospital regulations as part of that deal. And, yeah, over the next several weeks, they will pass a bill that brings billions of dollars to the state, particularly to the hospitals in the state, and expands taxpayer-funded coverage, healthcare coverage to hundreds of thousands of people, many of them, as you said, the working poor.
So, as you mentioned, the deal will bring insurance to people who really need it. So why is this even controversial? What took so long? Am I missing something?
Well, I mean, it's very expensive. It's mostly funded by the federal government, billions and billions of dollars over the next however many years it will bring in. We spend at a deficit in the federal government. We're $32 trillion when you look at the national debt. So there are a lot of people who feel like, well, we can't afford this. We don't actually have this money at the federal level. And then there are other people who have felt like the federal money would eventually go away. The way Medicaid works is the federal government covers most of it. But there is a state portion. Now, the state portion in this case is going to be covered through some complex machinations. That basically means the federal government largely is going to cover that too. We don't necessarily need to get into all that. But there was a feeling among Republican lawmakers, or at least a stated feeling, that eventually the federal match would shrink, leaving the state holding the bag. You add hundreds of thousands of people to government health insurance rolls. Federal government doesn't do what it says it's going to do 5 years from now. Do you as a General Assembly then have to kick all these people off this health insurance plan and be like, well, sorry? Or does that suddenly become a state budget priority where you have to spend that money, state taxpayers spend that money? That has kind of been wiped away as Medicaid expansion, which was a part of Obamacare, the Affordable Care Act, back in 2010. This program was created. As that has continually survived legal challenge after legal challenge, that concern has faded away.
So Democrats have supported this from the beginning. Republicans initially were opposed. They recently had a change of heart and suddenly started supporting it. And yet they still couldn't get it done in the last legislative session when the Republicans controlled both chambers of the legislature. What happened in that evolution in thinking, and why couldn't they get it done?
So I think it's a few things. Number one, this was associated with Obamacare, which I think Republicans maybe had dubbed Obamacare to kind of hang these changes that we passed in healthcare at the federal level in 2010 around the former president's neck. It had a real negative connotation. That has faded as time has gone forward. And what we've seen in rural counties in North Carolina is hospitals really struggling, hospitals in some cases closing. And so you've started to have Republican county commissioners, Republican sheriffs get on board with this idea of expansion and say, we need this, our people need this. And Republican legislators who represent those constituents started to get on board. And it just started to make more and more financial sense. Now, why they didn't get it done until now, last year when kind of the ground shifted on this, and Senate Republican leaders came on board with the idea. That was the big thing last year. But they also wanted some regulatory changes that they say would boost the overall supply of healthcare in North Carolina. So things that would boost the number of not hospitals, but places you can be seen by a doctor, number of MRI machines, for example, ambulatory surgery centers, and also that they wanted some new loosening of regulations, not just on hospitals, but on nurses, so that APRNs, advanced practice nurses, who have a master's degree and are pretty highly trained, could do some things without a doctor specifically having to sign off on it. These were all kind of proposals meant to boost that overall supply of healthcare before or as you give health insurance to another, few 100,000 people.
Okay, so if I'm somebody affected by this deal, what happens next? When can I start seeing benefits?
Well, anybody who knows how slow government works knows it'll probably be a little while. This is announced. It still has to pass. We fully expect it to do so. It won't actually take effect, though, until a new budget passes. So it'll be a while, and believe me, you won't be able to turn around without hearing about this thing when it finally gets done.
Well, why is that? Why doesn't this get done until the budget passes?
All right, so that's going to be written into the bill as announced today, is that the Medicaid expansion every bill that passes has an effective date, and this effective date is tied to the budget. The reason Republican lawmakers are doing that is because they're going to put things into the state budget proposal that Democrats don't want, that Governor Roy Cooper, a Democrat, doesn't want. But they need support from either the governor or some Democrats, at least one Democrat, to get the numbers they need to pass this budget. So they are going to force Democrats to accept some sort of policies. I don't know what, but I guarantee you they'll load this thing up with a policy or policies that Democrats don't want in order to say, all right, you can oppose our policies in the state budget, but if you do that, you kill Medicaid expansion, which has been your biggest goal for a decade. So it's politics, smart politics, leverage politics.
And money.
Right. I mean, the hospitals want this bad because it's billions of dollars that will help their bottom lines. They will get more customers out of this.
Let's take a quick break. When we come back, we'll hear a little bit more about lawmakers' deal to expand Medicaid and who else benefits from the agreement. Stick around. Welcome back to the WRAL Daily Download. We're talking with WRAL state government reporter Travis Fain about lawmakers' deal to expand Medicaid in North Carolina. Travis, legislative leaders really had to get into the weeds on this deal. So what's in the deal? What's not? What were the sticking points? What might you see as this thing goes on?
So we talked a little bit earlier about hospital regulations. That's a program called Certificate of Need. A certificate of need is something that the state government gives you if you want to expand a hospital, build a new hospital, add an MRI machine, add more beds to your hospital. You have to get permission from state regulators to do that right now through this process called Certificate of Need, or CON. And hospitals like this because they want the limit to competition. Hospitals have to pay for a lot of things that don't make money, so they don't want a bunch of competitors coming in and doing things that do make money, like an ambulatory surgery center or imaging, like with an MRI. So one of the things that is part of this deal is not a repeal, but a rollback of a bunch of those rules. So if you're a doctor's group and you want to add an MRI machine, it'll be easier to do it under this deal. If you want to start a surgery center, it'll be easier to do it under this deal. If you want to open new beds for behavioral health, chemical dependence, addiction services, it'll be easier under this deal. And all that is, again, as we talked about earlier, kind of increasing the total supply of healthcare because you're about to have a whole bunch more people who have insurance and can pay for healthcare.
And you also mentioned that the Senate wanted to loosen regulations on certain nurses. Why did that go away? Yeah,
that got jettisoned from this deal after being a sticking point for, 6 months, 8 months, something like that. It's called the SAVE Act, SAVE. It deals with advanced practice registered nurses and giving them more authority to do things that they're trained to do, but right now the law requires them to have a doctor to sign off. And what a lot of nurses will tell you is that sign off is literally just a signature on a piece of paper. It's paper supervision, and doctors charge nurses sometimes tens of thousands of dollars a year for this service. And the idea was, all right, well, let's just free up the nurses to do this stuff on their own. It will help us bring more nurses to North Carolina. We've been told that nurses leave North Carolina to do this sort of work in other states. 26 states have passed something similar to the SAVE Act. So the idea is, well, let's entice nurses to stay here and serve people. I mean, a lot of times if you're going to a healthcare practice, you're dealing with an APRN. They are among the most trusted people in healthcare. But the doctors were dead set against this and clearly lobbied hard enough to get it jettisoned from the deal.
Now, you've been covering the legislature for a while now. You know the key players. What does this deal tell you about the Republican legislative leaders?
It tells me where their constituents are. I think we talked about this earlier, where just the ground shifted. The reality of medical debt, of hospital closures, it just became untenable to continue saying no to all this federal money. I mean, you can have all the opinions you want to about federal deficit spending. The reality is it's happening, and it's benefiting healthcare systems in other states. I believe 39 other states had expanded Medicaid. We will be the 40th. And it just became impossible politically to say no to the money, I think.
How do Democrats feel about this deal?
A little bit happy, or a lot happy. This is a major priority for them. I suspect they're tired of hearing Republicans use talking points that they were using 10 years ago, though. I've sat in many meetings and heard Republicans talk about how great Medicaid expansion is and thought, you and I both heard this for a decade because Democrats were saying it. But I think they'll take the win on Governor Roy Cooper's probably number one policy goal here.
Now, is there any way that this deal falls apart? Could anything upend this thing?
Yeah, things can always get derailed, but I mean, the press conference had Speaker of the House Tim Moore at it, Senate President Pro Tem Phil Berger, so the two top leaders who've been negotiating this thing. I think the tracks are greased on this, and you never say never, and you never say for sure, but this looks pretty solid.
Well, Travis, I know that you'll be keeping up to speed on it. Thank you.
Yeah, anytime.
That's WRAL state government reporter Travis Fain. For all of our Medicaid coverage, visit the NC Capital section of WRAL.com. I'm Jack Hagel. Thanks for joining us, and thanks for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.